So I think the most important thing in terms of diabetic management is to enable the patients to, or rather to increase their awareness about the disease and to explain to them clearly what the complications associated with the disease are, because this will help them in terms of compliance, right? So if you look at the diabetes management, I think the most important thing is making sure that you follow a healthy diet, right, where you reduce your sugar intake and make sure that your carbohydrates are also of the lower glycemic index carbohydrates. Exercise is very important, right, to ensure that you maintain a healthy weight range. So for example, if your body mass index, which tells us for your height what your ideal weight range should be, if you're in the overweight or obese category, by reducing your weight, you're reducing your sugar levels, your cholesterol levels, your pressure, and thereby the risk of the complications associated with diabetes. So engaging in regular moderate intensity exercise is very important. At the same time, if you are a smoker, stopping smoking or quitting smoking is very important, because the complications associated with diabetes are 4 to 5-fold more in people who smoke, right? At the end of the day, it's also important to have regular follow-ups, right? When you talk about diabetes management, a lot of patients feel that they can see the doctor maybe once a year or once in 2 years, right? So this is a problem, because based on local and international diabetic guidelines, all diabetic patients must do their annual diabetic panel, which compromises of a blood test, the urine test, your diabetic foot screening, and your diabetic eye screening. And thereafter, based on your sugar control, your doctor would advise you whether you need a 3-month or a 6-month follow-up. So managing diabetes in a nutshell is not only about diet and exercise or taking your medication, but it is doing all these three and ensuring that your results are in keeping with the targeted goals.